If you've got any discomfort around the medial or inner knee, this might be helpful for you, especially if you know that the inner thighs are tight. Trying this out, you might realize that they're tight and contributing to some of that maybe tugging sensation or sensitivity in the inner knee. First one that I'll show you is with a foam roller. It's going to be broader pressure, but you'll lay it on your side. You can support your head however you like. You can lower all the way down. You could take a block underneath it, but you'll take your knee up so that the inner knee is compressed by the foam roller. And so already you might notice a lot just hanging out here, but you can add a small roll and a forward and back. You can also slowly, this is pretty intense, lift and lower the leg, right? Rotating the hip as the foot lifts and lowers. And then you might try pushing the knee up towards the top of the roller and then sliding it down. It's a really subtle action, up and down, but giving different angles of pressure with these different rotations, with the forward and back, the up and down, bringing some different feedback into the thigh. Now you can take this further up the thigh and keep that work going, but you might just isolate the pressure into the knee if that's where your discomfort is. But oftentimes you'll probably find you keep rolling the foam roller in that there's a good amount of tightness sensation all the way up. Second thing is going to be maybe a little more specific to the knee. It's the same technique, but using a lacrosse ball instead. You'll find some elevation. I've got a yoga block, but it could be a book, it can be anything else. Same thing, right? Upper body, however you want, and then placing the ball on the block so that it's elevated to compress into the knee. And all of this, right, you're just finding the places that feel relevant. So that might be directly pushing into a muscle, it might be in the space between the muscles that you find it. And again, just this simple pressure down, especially if you add just a light weight with your hand, might feel like enough. You can do that up and down, forward and back. The rotation, that tends to be the most sensational for me, but the lift and lower of the foot as well. I would choose one or the other so that you don't beat that area up too much, right? Too much work in that area could just be aggravated, so you want to do just the minimal amount that brings some relief, brings some change.